In one of your videos, you shared your daughter's story with Alice in Wonderland syndrome and hallucinations. You said that she heard a man's voice screaming from her room at midnight, but found her asleep. Later, she woke up terrified, saying a man kept yelling, "Take it down, take it down." She hadn't seen him, but described his appearance in detail and experienced similar episodes afterward. How can we distinguish between visual hallucinations related to Alice in Wonderland syndrome and vivid imagination or imaginary friends, especially in children?
Gosh, that's a really good question. I think in that situation we had a very much a shared experience. So that to me that was kind of like, okay, well we both experienced sort of the same thing. So since it was shared, it seemed like it was very real in that way. Whereas other times things can be not quite as concise.
Yeah.
Yeah. I don't know if that answers that, but
So how can, for example, children who have Alice in Wonderland syndrome, how can we know if you are using your imagination, seeing objects getting bigger or smaller? Because especially in the age of 5, they start using their imagination or having imaginary friends. How can you differentiate between like those visual hallucinations and imaginary friends?
Well, the hallucinations feel like very real compared to like imagining things, which like aren't real. Um, so when you actually are going through it, like it feels like it's actually happening compared to like imagining something.
Okay.
You just don't visually see it.
And also, Nathan, you mentioned that when you were 5 years, you look at the sailing fan and perceive it as moving closer and farther away, appearing bigger or smaller. You
Yeah.
remember when you shared
Yeah.
in one of the interviews, and you said that you start to see it as a kind of friend and give it a sense of charm rather than fear. Is it considered to be a coping mechanism for you? And how often, if so, how often do you use this kind of coping mechanism?
Yeah, I think at the time it was a coping mechanism, but as I've been getting a little older, it's happened less, so I haven't been using it as much because I haven't been having as many sessions.
So during similar episodes, do you usually feel scared, more cautious, or rather calm and playful?
It's more scary because back when I was like 5 years old, it was happening a lot more often, so I kind of like got used to it. Well, now it's sort of like a shock because it doesn't happen as often.
And how do you and your sister pursue the world in general? Like, would you describe it as more imaginative or fantasy-like compared to other children?
Probably not.
no, especially my daughter, she's very practical and
Yeah.
grounded. Doesn't really even like with the fantasy movies that we do watch.
Yeah.
She's kind of like, whatever, I'm not really into that. I think given like the realness of things, I think too, I mean, I don't know how many of my videos that you've seen, but I've personally done a lot of work in sleep, kind of in the in-between sleep state. And there's just a very distinct difference between something that is very much outside of yourself, and very real when you're hallucinating versus kind of this imaginary state, that kind of lives in this kind of foggy land. So, I can only speak for them. I don't have Alice in Wonderland syndrome, but I certainly have my own experiences that there's just a distinct difference in
Yeah.
that way.
Yeah.
I don't know if you
Yeah.
want to say more about
I
that.
agree.
Yeah. It's like once you experience it, you're like, oh yeah, that's very clearly outside of myself. And it kind of makes your heart come out of your chest, and very real. But with experience comes the knowledge of that.
And Nathan, how do you interact with your sister when experiencing an episode?
Um, because this episodes normally happen at night, like when I'm in bed. I don't know, maybe because I'm like kind of tired or daisy. It also happens a lot of times when I'm sick specifically. And so normally like my sister isn't there, so I never really like talk to her during the episodes. Sometimes I'll like mention it like the morning after to her, but that's about it.
Are there any similarities or differences in how each of you cope with the symptoms?
I'm not really sure how she does it because she doesn't really talk about it much.
I don't really know that she has a lot of recall like Nathan
Yeah,
does. Yeah.
I think it's kind of just like a daze for her.
Like almost like remembering a dream.
And Jamie, what behavioral or emotional challenges have you noticed in Nathan and his sister that may result from Alice Wonderland syndrome, like anxiety, fear, confusion, or difficulty with daily activities?
Um, None, I would say. I mean, yeah, I'm very fortunate that these experiences haven't really um, caused them to have any anxiety or fear. In fact, my daughter is kind of like, yeah, just leave the lights out and off you go to bed. Like even to this day, I've never had her even wake me up in the middle of the night, except for that one time, a couple times. But she just doesn't have a whole lot of fear of anything. Same with Nathan here. It's always just been like, okay, this is what happened. I don't know why is it that you never really kind of were real overly fearful of it, do you think?
Well, I think it's kind of because like wasn't like actually happening,
Hmm.
you know? And I also like started like as I said, I developed coping mechanisms, so I kind of like knew what to do in the situation more than like before.
Can you share us some of the coping mechanisms you use and why you think that they are effective and whether other people are going through the same symptoms can use it?
Um, so one of the coping mechanisms I use is like turning on the lights and kind of just like calming down, like maybe meditating or something. Because I think it's kind of like in the moment you're like really anxious, kind of like feeding into the fire. So I think that like maybe calming down, like meditating, reading a book, something like that always helps me because I'm like being able to like take it back a step and look at the situation.
And how do your classmates interact with you during or after an episode? Are they aware of the condition? If so, how do they respond?
No, most aren't aware. In fact, I was actually talking to my friend today about this interview, and they were like, "Oh, I didn't even know you had that. What's it like?" And I kind of like started explaining it to him.
Hmm. So they are still not fully aware of as Wonderland syndromes or the symptoms you experience.
No, mostly because it happens during the night, and
Hmm.
as I said, like, it doesn't like come up in a conversation.
Yeah, you just wake up and you kind of move on, right?
Yeah.
Yeah.
And have any of these symptoms improved or disappeared over time?
The symptoms have improved a lot. I've had a lot less episodes recently. I mean, my last one was probably like when we made the video,
Yeah.
which was like how long
Like a few
ago?
months ago.
Yeah, a few months ago. I think it's because I'm like, getting older. I think it was kind of like something I had more often when I
Hmm.
was younger.
And to,
So,
mhm.
The research I've done is shown they age out of it, yeah. It's a lot of young men as far as I know, between the ages of like, 8 and 14 or something. So in my YouTube channel, I've heard from a lot of people that are like, oh yeah, a lot of young men that say, I had that when I was a kid. One of my friends was like, oh my gosh, that's what I had when I was a kid, and it's like nobody told me what it was. Um, but the distinction too is that Nathan, he had the one episode when he was very, very young where it was almost close to what I would describe as a very schizophrenic episode. And he was not conscious, at least that I could tell. He only had that once, maybe twice when he was very little, maybe 6. And from there, it moved into this mode of just the depth perception problem. Whereas Eve, my daughter Eve, has not had this depth perception problem that she's at least told us about. She's just had this sort of high fever, for lack of a better word, schizophrenic type situation. I don't want to call it that. I guess it's more of a clinical term.
yeah.
But you know what I mean? So it's kind of there's a distinction there between the high level hallucinations, at least in my mind, and then what Nathan is calling Alice in Wonderland syndrome, which is this depth and sensory perception problem.
Yeah.
Apart from visual distortions, what non-visual symptoms have you experienced related to Alice in Wonderland syndrome, such as depersonalization, derealization, or altered perception of time, like feeling that time speeds up or slows down?
The time perception one's like really big. Like one time when I was like kind of like cope with it and calming down when I was reading a book, like I was like reading a chapter and like suddenly it was like an hour has gone by. And as for non-sensory things, like my ears, when having an episode, like it'll get like really like panicky and like almost loud. even though I'm not hearing anything. Get like super quiet, like the quiet in movie before a jump scare where it's like a scary quiet.
And what do you expect people around you to interact or approach you
Um,
in this
I wouldn't,
situation they provided me?
no, I wouldn't really expect them to approach me about it because like normally it just like doesn't come up in a conversation, like you don't really chit chat about it.
Right.
Like I guess I'll bring it up, but like it's not like they'll ask.
Yeah. I mean, it's not something that you vocally like
Yeah.
think about sharing.
So, since S. Wonderland syndrome is not even officially listed in the DSM or ICD or the International Classification of Headache Disorders, how can you navigate the diagnostic uncertainty, Jamie, and distinguish it from schizophrenia spectrum disorders?
Yeah, I mean, I think for me personally, I mean, I would imagine that because I have a very strong sleep induced trance, lucid dreaming, like kind of history myself, um, that it's very natural for me to sort of go that next step and say, well, sleep, he's half asleep, he's hallucinating. It doesn't happen during waking life at all. I mean, it does kind of like before he goes to sleep kind of a thing. But
Yeah.
I guess that, I mean, I would imagine that if I didn't have my history with what I do and what I've been practicing and the things that I study and practice, that it would be really scary. And I probably would really, really, really concerned. But because I know from experience that the in-between sleep state is the place where you can kind of have these experiences that range, in my perspective, from extreme imagination to extreme reality. There's a whole spectrum of things going on in that state. It was very easy for me to be like, all right, Nathan, just you go right here, this is kind of what's going on with you and doesn't bother him, it's not like it's concerning. It just was kind of easy in that way to be okay with it.
Yeah.
Do you think, Jamie, that as Wonderland syndrome is genetic? Or if there is a family history of mental health conditions? Because in one of the videos I watched about you, you said that you suffered from anxiety, you embraced depression when you were a child. So do you think that it may be caused by genetic factors?
I mean, I very well could be. Yeah, I mean, um, I can only go off what my history shows me, in general. I don't know a lot about my family history because I'm adopted, so I don't have that history to look back on. I'm adopted, so I don't have that to look back on. It very well could be. I wouldn't be surprised. I wouldn't be surprised, but I mean, I don't tend to think that. I mean, I've talked to like my adopted mother, and we have very little interest in common. She's never done lucid dreaming. She's never had any kind of like experiences like that. I don't know. What do you think? I think it could be, but I don't know.
I think it could be, but we don't have enough information because like our like family history or our ancestry is kind of like clouded.
Yeah, there's no way for us to know. So,
And do you know if there is, let's say, family history of migraine? Because based on the available data, I read that children with Aspen-Wonderland syndrome, some of them suffer from migraines, and after that, they start experiencing the visual hallucinations. So, do you believe that Aspen-Wonderland syndrome might represent a migraine or migraine equivalent?
in our history, no.
Yeah,
I
I've
don't,
never really had a migraine.
I
I've
don't think.
had a headache, and it happens mostly like most of the times it's happened is when I'm sick. And so I think it has something to do with that, but me personally, I don't think I've ever had a migraine that I
No,
remember.
you would remember.
Yeah, no, I don't think so.
Yeah, I
Nathan,
don't have the answer.
mhm. Would you like to add
Oh no,
something?
I was saying I don't have a history of migraines either in my
Mhm.
family, as far as I know.
Nathan, can you describe the symptoms that you're still encountering, the visual symptoms?
Um, the symptoms I've kind of been like encountering is like so I'd think of like sometimes like I'll think of like a large map. It's kind of like overstimulating. So one time I was thinking of like a large map and then like it rapidly zoom in on like a random point and like so that sudden like shift is kind of like causing that issue.
Wait, what? Can you say that again in a different way? I want to
What do you
know.
mean?
So you were imagining a map, is that right? Or you
No,
saw a
no, no,
map?
like this is like an analogy.
Oh, an analogy, I'm sorry.
And what about the other non-visual symptoms? You mentioned time perception. Is there another non-visual symptom you are also experiencing?
Um, well, there's the sound I said, but I think that's kind of random. Like I've never really seen like a pattern or anything to go with it. And time perception's like kind of wacky because you don't really know what's happening, you know?
You also believe that yourself is not real, which is related to depersonalization, derealization.
Yes, I do not think like I think about like it not being real to kind of like cope with it.
Are there any medications you take to control those symptoms?
No.
Um, let's move to the last question. What advice would you give to parents whose children show symptoms similar to Nathan and his sister?
I give the advice of, like I said before, kind of like calming them down. Like you got to start with like them calming it down because when you're in the moment, it's like super scary and you're like full of anxiety. But if you like calm down, you can start like, taking a step from there. So start with like calming them down, like maybe breathing or meditating, things like that.
Jamie, what is your advice to the parents?
I mean, I think in all sincerity, I think I would only imagine a lot of parents would go very clinical with this. They would instantly want to rush them to the doctor, get a bunch of tests done. And I don't bemoan them to do that. That's their parental right. I would, I would just really recommend that they just paused and realized that there's a lot going on in the dream state. There's a lot going on in the sleep state. Hallucinations, visualizations. I mean, so many people have so many experiences that are not clinical, that are something else, and that it's not necessarily something to be so scared about medically. I think that would be my advice. It could be something that doesn't have to be scary medically, and it can just be a sleep issue.
Mhm. Can you, for those people who are going to watch this interview, can you explain more about the dream states and how it is related to Alice Wonderland syndrome based on your background knowledge?
Yeah, I mean, I think, for a lot of people that don't maybe pursue these kinds of experiences, they don't know what's possible or what they're truly capable of. But the truth is that in the sleep state, we have access to a lot of information, a lot of things that we would be very shocked to learn about. So, I mean, initially, people remember their dreams, but very few people really know what they mean. But once you really actually understand what dreams mean and the symbols that your subconscious mind is trying to communicate with you about an issue, it could be a whole host of things, your life will open up incredibly. You have access to so much information that your subconscious mind is trying to tell you. And from there, it's like, okay, well, you can push it a little bit more. And if you want to, you can actually become lucid in the dream state and become aware that you are dreaming while you are dreaming. And then go around and kind of talk to your dream symbols and find out what's going on with your subconscious. And that opens up a whole nother thing. And it's all about becoming consciously aware and awake in that realm. I could go on and on about that in terms of there's a lot of things that you can do. You can fly, but the truth is that there's the possibilities are endless. And yeah, so I think for me, this Alice in Wonderland state is just another on the spectrum, another piece of the puzzle, another thing, another moment where we're kind of touching the in between, touching the sleep, touching the subconscious, for lack of a better word. I mean, it gets very spiritual at that point, if you really think about it. And I think a lot of people are kind of maybe perhaps uncomfortable to talk about kind of that spiritual aspect of it. So if we want to leave it in the realm of psychology and say, well, this is your subconscious mind, this is access to things that you don't have normally in your conscious waking life, like the richness of your mind, that's fine. But if you do want to look at it spiritually, it can be very, very rewarding and very, very powerful. So, and I think Nathan and Eve's experiences are just another part of that spectrum of different levels of consciousness in the sleep state.
Can you explain more on the spiritual aspect?
Yeah, I mean, the truth is that I, I mean, I could go on. I personally come from more of an experiential knowledge base. So when I experience things, that's when I learn. I'm not one to really be told what's right. Um, I, I have a whole YouTube channel about my discovery into all of these things. Um, but there are things outside of ourselves that you can access in there. I'm probably only touching the tip of the iceberg with that, with my own practice and what I do. There's probably a lot of possibilities. Um, but yeah, I mean, to have access to things that are outside of yourself, prophetic things, information that you don't know. I mean, we can get into remote viewing, these kinds of things that are just sort of impossible things to do are actually very possible and very real, you know? So, I guess, I mean, I don't even know if spiritual, is that the right word? It makes it sound very, it's very real and it's very things that we can do. Does that make sense?
Yeah.